Hi, welcome to the Duty of Care training. This training will go for about 15 to 20 minutes and we'll be talking about duty of care and what it means, particularly with a focus on providing therapy services. So the training is really for speech pathologists, occupational therapists, psychologists and therapists within real therapy solutions. Duty of care is a legal term, and the picture here of the elephant on the ball is because often understanding how to put your duty of care into practice can be a balancing act, and a lot of ethical dilemmas that we face as therapists come out of our duty of care. So duty of care is everywhere. So we don't just have a duty of care as a therapist. When we drive a car, we have a duty of care to do what is reasonable when we're in control of that motor vehicle to prevent foreseeable harm to others. So around that, we have the laws and legislation around driving a car and being on the road. Doctors have a duty of care. So depending on the role that you have, your duty of care may be different. And the difference comes from your qualifications, experience and training. So, but essentially we all have a duty of care towards others as a legal obligation, but that duty can be dependent on what role you have at the time, your qualifications, experience and training. So a therapist, for example, has a duty of care to anyone who is reasonably likely to be affected by their work activities. So that includes obviously your direct clients that you see, but can also have a ripple effect out to their families and to some degree other people in the community. So for a duty of care to be in place, they have to be affected by their action or inaction, and an injury needs to have been foreseeable. So, for example, because you didn't act in a certain way and somebody was therefore harmed or injured, and it's foreseeable that that harm could have occurred, then that could be a breach of your duty of care. So it can be an action or something that you didn't do. Now, we're going to talk in a minute about how do they understand what's foreseeable and what's reasonable, because right through the duty of care discussion, you will hear and see the terms reasonable and foreseeable. These are actually legally defined terms, and we'll outline what these are in a minute. So what is duty of care not? Duty of care is not about being psychic. You are not expected to see into the future. And when we often work with people with disabilities, I often hear people talking about the fact that, well, if that person goes out into the community, walks down the street, they could get hit by a car if they jump onto the road. Well, that's really the same for everybody. We don't really have a right to stop people from doing something because there is a slight possibility that something may happen to them if they did something else. We're also not expected to be able to see into the future. So the term reasonable and foreseeable are very strong terms here that we will define in a minute. It's not about being responsible for the actions or decisions of another adult. So you're not responsible for the decisions that somebody else makes. When we support people with a disability, and particularly adults, there is absolutely the question of, do they have the capacity to make that decision and to balance the risks associated with whatever decision they have made. And that's a different question, an important question that needs to be considered. So for the behaviour support practitioners and psychologists specifically working in behaviour support area, this is something that comes up a lot, the duty of care versus dignity of risk. Are we responsible for the fact that somebody makes an informed decision that has risks associated with it? No. Are we responsible for outlining those risks, and if we are concerned about a person's capacity to make that decision, to address that and raise that? Absolutely. So duty of care is not unique to disabilities. It's across all. If you work as a therapist outside of disabilities, then you also have a duty of care. It's also not something that you don't have anything to do with outside of work. And as we mentioned on the slide before, You have a duty of care when you're in the community. You have a duty of care when you're in a shopping centre. It's just a little bit different. The parameters and the framework by which we look at that duty of care can be a little bit different in those roles. So what is duty of care? Duty of care is a legal duty determined by the courts. So it's something called common law or case law or precedent law. So that's why you cannot look up the legislation around duty of care. There's no Duty of Care Act. We have a Crimes Act, we have a number of other acts, but we don't have a Duty of Care Act. And that's because duty of care is determined by judges. So past decisions made in courts of law are called precedents. And the requirements are that the legal system, the judges that make the rulings, have to take into account previous decisions that have been made in a court of law. So duty of care is really all about what decisions have been made in a court up to now. And that's one of the things that can make it a little difficult, because there's no written act that you can go to outline, oh, well, this is my duty of care in this circumstance. And that's where our terms reasonable and foreseeable come from. Often, particularly when you're working in the behaviour support realm in the disability sector, it's about a balance of human and legal rights. So what I mean by that is we often, and I'm going to use the term in quite an extreme version, but we often breach a person's human rights. So for example, a basic human right is freedom of movement. When we're working with adults who have significant challenging behaviours, we might be considering using strategies that actually breach this basic right. So it may be something like putting them in a seatbelt buckle so that when they're in the car, they can't undo the seatbelt and move around. Now, this is something that also jumps into the legal arena, because there is a piece of legislation that talks about the need to wear seatbelts in a car. So, of course, when a person is not wearing a seatbelt, they're actually going against that law. But we're also breaching their right to freedom of movement when we're locking them in. So when we're looking at our duty of care around the harm that it can cause to them, and the fact that there is legislation that says this person should be in a seatbelt when they're in the car, then we weigh that up when we make our decision. But for example, if we're using something like exclusionary timeout, and we are putting someone in a room or an area and we're not allowing them to leave, then again we're breaching their human rights. There's no there's no law or written legislation that says that we can do that, but we might be balancing it up against the fact that they are out of control, very violent, and pose a significant risk of harm to themselves or other people at that time. Here we have this dilemma of what to do, because we are breaching their human rights, but we're also trying to protect the human rights of other people where that risk is associated. So duty of care is often when you're making a decision about, do I breach someone's human rights, particularly when we have two people in, or am I doing the right thing by them? One of the big things is it's about following policy and relevant legislation. So it's important to keep up to date on what the written legislation is in the areas you're working. And as a therapist, one of the main areas that you need to keep on top of is your code of conduct. So your code of conduct as a psychologist, a speech pathologist, or an occupational therapist will touch on your areas of duty of care. So for example, a therapist area of duty of care that the codes of conduct usually very clearly state out, and I know the psychologist one does, is about working within your area of expertise, not stepping outside of that area and working in an area that you don't have enough training, support and supervision to work within. That could be seen as a breach of your duty of care. So make sure that when you're considering, am I doing the right thing? Am I breaching this person's rights? Am I acting within my area as a therapist when I'm impacting and putting strategies in place for other people? Make sure that you're referring to your codes of conduct, and you should be refreshing up on them at least every quarter, every 3 months. The other thing duty of care may involve is identifying and assessing risk. So there are risks in everything that we do. And as a forensic psychologist, we do a lot of training in risk assessment. Now, if I step outside and cross the road to get a coffee, there is risk associated with that. If I have my phone in my hand and I'm looking at my phone, that risk might be heightened because I'm not looking at the street and I could be hit by a car. But then I need to look at the likelihood of that risk. Have I been hit by a car in the past? Am I known to look at my phone and not look at the street? Is it a busy street? So there's a number of other factors that come into play. And I would strongly suggest that when you're looking at risk, that you confidentially engage a supervisor or a co-worker to assist with identifying and assessing those risks associated around anything that you're putting in place. So again, focusing on the behaviour support area, we will often be asked to stop someone from going in the community because of the risk their behaviours pose to themselves and others. We really need to assess that risk against the fact that we are breaching that person's basic human rights to freedom of movement and also as a valued community member. So identifying and assessing risk is part of what you should be doing when you're considering your duty of care to others. And I guess the other side of that, the dignity of risk side, is allowing informed decision making. So of course, working with children, often this decision making falls on the adults depending on the age of the child. Working with adults with a disability, we need to work from the approach that anyone over the age of 18 is legally deemed capable of making their own decisions unless determined otherwise. So what does that mean? That means that we shouldn't approach a person with a disability who is an adult or a situation that involves an adult with a disability and say, well, because they have a disability, they don't have the capacity to make their own decisions. We should approach that situation from, this is an adult. Is there any evidence to suggest that they can't make this particular decision? Because when we're looking at capacity to make decisions, it's not a blanket capacity to make any decision that we look at. We're looking at the capacity to make this particular decision at this particular time. And of course, when we balance that with identifying and assessing risk, we're also looking at minimising any of those risks and working with the person to minimise those risks. As therapists, we do a lot of work on ethical guidelines and ethic decision making, and I know that as a psychologist we do a lot of this both at university and in our provisional programs. Ethics is a system of beliefs about moral judgment and right conduct. And yes, it does come into play with duty of care because it is about the right conduct and what other people would do in the situation with your training, skills and experience. Ethics sort of sits over and above our duty of care. There's a much broader concept that people call like best practice or being professional, being a good disability support worker, being a good psychologist, being a good therapist as viewed by others. And I touched on these here because I think they're very, very important, that we're looking here at, okay, what's my duty of care as a legal obligation to do what's reasonable and what another psychologist, occupational therapist or speech pathologist would do in this situation. You know, maybe they would consult their supervisor, therefore I should do that. And then above that we have these ethical, these moral judgments and right conduct that is usually, you know, discussed in academia, distributed as ethical guidelines, ethical dilemmas, and they come from a code of and a system of beliefs that come from society or a group of people in society. Over and above that, I think that, you know, there's something that we look at as being a professional and best practice and having parameters in which we recognise these are very, very good practices and what I should be striving for. And I think those three tiers are very important, knowing that duty of care is one of them, but even over and above that, there's the right thing to do and there's practicing as a professional therapist as well, and using those three frameworks of duty of care, reasonable and foreseeable, and ethical, the right conduct and the right thing to do ethically, and above that, what is the best practice? What would the best psychologist or professional do in these circumstances? Are great frameworks to make decisions about how you work and support your clients. We need to identify likely risks of harm. So I'm going to harp here on behaviour support again, because this is where it's, I guess, more pertinent and you'll come across it more often, is the need to identify risks of harm. So when we're working with someone who has, challenging or difficult behaviours, sometimes those behaviours do pose a risk of harm to the person or other people. So when we're actually assessing that and identifying it, we need to be very specific and look at in this situation. So in the home environment, in a shopping centre, what are the specific risks if this person engaged in that behaviour? And then what risks come out if we put a certain practice in place? So what are the risks if we, say, for example, use physical restraint on a person? Well, first of all, we're breaching their human rights. And that's something that we need to consider. Often physical restraint is the last resort and needs to be put in place, and the restricted practices training will outline what those things are that the behaviour support practitioners do. But also within that, we need to be aware that we're breaching the person's rights, but sometimes it is necessary because the risks are so high. But we also need to recognise that from physically restraining people, there are risks associated with that, both for the people doing the restraint and the person being restrained. So we're identifying the risks all around. And what if I choose not to put anything in my behaviour support plan? Or what if I choose to tell the staff not to do anything when that behaviour is happening? Well, that might be the right decision, but we also need to identify what risks are associated with inaction as well as action. Remembering that duty of care is linked to what you do and what you don't do. So we're looking here at things that are reasonably foreseeable. So given what we know about the situation, what has happened in the past, is it likely that these things will occur? So, for example, I use the example of going out to get a coffee and crossing the road. I've been across the road to get a coffee numerous times, probably 50 times in this street. Never even had a near miss of being hit by a car. Do I usually look at my phone as I cross the road? Well, let's do a bit of an assessment on that. Well, let's do an observation. No, I don't. I usually put my phone down when I cross the road. So we can see there that the risk is being minimised. So is it reasonably foreseeable that I would be hit by a car crossing the road to go get a coffee? Probably not. There's no indication that that has happened. Is it something that could happen ever? Of course it could. Hopefully it won't, but of course it could. But they're different. Identifying that something could happen and then protecting someone or stopping someone from doing something because something could happen is different from identifying that it's reasonably foreseeable that it could happen. You may identify that something's reasonably foreseeable based on an action or a strategy that you put in place, but you may then put strategy in to minimise that risk, which removes the likelihood or reduces the likelihood that that can happen. Reasonable care is something that we need to do in response to likely risks of harms identified. So as a therapist, if you identify that there is a risk to one of your clients, you have an obligation there to respond to that. You need to take reasonable care, which means you need to put strategies in place to try to minimise that. Not perfect care. You're not expected to move heaven and earth. You're expected to do everything within your resources, your experience, your training, absolutely to consult with a supervisor or a co-worker, but you're not expected to go over and above. So, for example, as a psychologist, there has absolutely been times where I have not gone home. I've stayed with a client because they were at serious risk of harm until I've brought in other resources that have been able to support that situation. Am I expected, however, to leave my home because I believe a client's at risk, go and knock on their door and escort them to a mental health facility. Probably not. First of all, I don't have legal powers to do that. But am I expected to flag it at some stage as quickly as possible and support that person to get assistance? Absolutely. So we need to look at the resources that we have, and often when we're providing behaviour intervention and support, we are limited by those resources. So an example would be not engaging in exclusionary timeout, but bringing in additional staffing resources. Now, I don't necessarily think that would be the best option, but it's a good example to give. However, we don't have the resources to pay 3 extra staff members who can manage that situation without putting someone into exclusionary timeout. Should we be looking at other options? Definitely. But sometimes we are limited by our resources, our own experience and the training that we have and our ability. And certainly if it's your ability, experience and training, then you need to discuss with a supervisor ASAP as soon as possible about any duty of care dilemmas or ethical dilemmas that you're coming across. So I've mentioned the codes of conduct. Very important that you're aware of your individual codes of conduct. They are kept in our way we do policy manual. Make sure that you look those up. They'll also be attached to your peak bodies. So the Australian Psychological Society, Speech Pathology Australia and Occupational Therapy Australia will all have those codes of conduct, and you should be very, very familiar with those. They outline how we should respond as trained therapists in specific situations and even in broader situations, and they offer a framework for our decision making. Certainly for behaviour support and psychology, the Australian Psychological Society has guidelines on working with people with intellectual disability and also guidelines on restricted practice use with people with intellectual disability. So these are something that as psychologists and even as behaviour support practitioners, I would recommend that you take a look at because they certainly fit into these areas. So it is a balancing act managing the duty of care. You need to balance reasonable care with all the other issues that are happening, including the rights and the needs of the individual. So particularly when we're working with people with disabilities who may have cognitive deficits, we also need to recognise that legally the person is an individual and does have the right to have some involvement in their own decision making. Now, the only exception to that is if they have a guardianship order in place, which is an order by the Supreme Court that has determined that that person is not capable of making their own decisions, and there has been a substitute decision maker identified. So there is another training on guardianship and understanding guardianship orders and substitute decision makers, but you do need to be aware that in those circumstances, it's not that we ignore the person with a disability. It is that we recognise, though, that legally a substitute decision maker has been made for them. It doesn't mean that we don't inform the person and we don't consult and collaborate with them. We don't pretend that they have the right to make the decision and give them the idea that they do, because they legally don't. But we can still work collaboratively and consult with the person. So the rights and the needs of a person, no matter what their disability type, no matter what their cognitive level, is very important when we're looking at duty of care issues, and recognising that person as an individual and as an adult. Obviously, safety of the person and other people is paramount and very important. And as therapists, and even not as therapists, privacy and confidentiality, and recognising that, you know, as therapists, particularly in behaviour support and psychology, we are privy to parts of a person's life that if they maybe didn't have a disability, we wouldn't be privy to. We are told and learn a lot about a person that we may not otherwise know unless they had a disability and we were brought into their life. And I think that's really important to remember, that some of this information that we have, although, you know, we need to consider when looking at dignity of risk and duty of care, we also need to recognise that, you know, we've been made privy to that information only because that person has a disability. So we need to consider all of those issues, and it's a balancing act, hence the slide at the beginning with the elephant on the ball. The rights and needs of an individual, particularly if you're working in behaviour support with adults with a disability, you need to be aware of human rights. Human rights are a vital part of understanding the framework in which we make our decisions in behaviour support, particularly those last resort strategies around exclusionary timeout, physical restraint, and I'll talk a bit more about that in the restricted practice training if you haven't already done it. There are legal rights, human rights, and legal rights that we need to be aware of, and both of these relate to duty of care issues, and often it's about breaching one of those human rights or legal rights in some ways, and that's why you're coming up with these duty of care dilemmas. Just some examples of basic rights: freedom of movement, physical safety, right to privacy, right to independence, right to self-determination, the right to gainful employment. These are all basic human rights. Our clients rely often, and I'm now really referring to adult disability services, rely on carers to realise and ensure many of their rights are upheld. And I guess it's the same for children as well, that there are people in our society who are more vulnerable to being exploited and having their rights exploited. And unfortunately, people with a disability are one of those groups. So we play a pivotal role depending on what role we're playing with clients. But behaviour support, we actually play a very important role in ensuring that our clients' rights are being upheld. And I believe that everyone has the right to have dreams and aspirations, and that those dreams and aspirations are understood. And I think, certainly goal setting for therapy and behaviour support, some of that is linked to what a person aspires to be or where they want to move forward. And understanding those is really important. And it's also important when looking at balancing someone's rights. Often upholding one person's rights may jeopardise the rights of another, and that's certainly the case in behaviour support in some circumstances. And I think that's important to be aware of, that while we may be managing risk, we may also be breaching another person's rights. I'm not saying that, therefore, that last resort strategy of, using physical restraint shouldn't be done. There are frameworks and contexts and authorisations for those. To monitor the use of those. So sometimes they are necessary, but I think it's important that we remember that upholding one person's rights can jeopardise that of another. And duty of care dilemmas are usually the result of that conflict of balancing those rights, which I've mentioned right through this. The other thing to remember when you're looking at duty of care situations is each situation and each person is different. So each client is different, and we should not make blanket rules. We need to consider what's reasonable and what would a reasonable person do in this circumstance. But we also need to recognise every situation is different, and okay, what are the contextual factors within this situation that I need to consider? And therefore we're assessing every time for each situation, and then we act based on that assessment. And I would add in there that we would also, consult a supervisor or a colleague around these issues. Informed decision making. We talked a lot about informed decision making through this discussion on duty of care. The law says that when people knowingly put themselves at risk, the duty of those around them is lower and sometimes non-existent. So knowingly speaks to that capacity to make decisions as well. But we all know people who make decisions that we believe are not in their best interests. So people may choose to smoke cigarettes, and you might believe that that's not in their best interests. There's evidence-based practice to show that smoking kills people, but the law's saying that this person, as long as that person has the capacity to make that decision and knows that decision, then the people around them have less of a duty of care. And this would very much play, this scenario would very much play into that of a doctor scenario. But it may play into a therapy scenario where someone knows what they're doing is posing a risk to them, but they continue to do it, but you're counselling and supporting them and outlining all of that. And I guess it does beg the question of, particularly when you work in the disability sector, does this person have that capacity to make that decision? And that's a consideration that you need to take very seriously, and that you possibly should be talking to your supervisors and colleagues about if you doubt that capacity to make the decisions. So in a crisis situation, I talk to people about making a decision based on your knowledge of the person's functioning ability. How do we determine if this person right now has the capacity to decide that they can leave here, run out across the road? First of all, if it's a child, you can assume that they may not have that capacity, because legally we're looking at around the age of 10. But it doesn't mean that that gives us the right just to lock the door and stop the child from going out, because obviously that's a breach of human rights, and you would prefer that if that's going to occur, it occurs by the parent, because they have very different rights to what we can do. But more talking here about the adult disability sector, you may go, okay, this person has a severe intellectual disability, therefore it is less likely that they have capacity. I need to make this decision very, very quickly. I'm going to do what I need to do. And the law accepts that when we make decisions in crisis situations, that we don't have the same ability to consider and reflect and gather all the information. But I think in a day-to-day situation, when you're looking at duty of care, we need to acknowledge a person's right to an assumption of competence. And that's what I talked about before, that over the age of 18, often 16, we're assuming that a person is competent and able to make their decisions, and you're looking for evidence that suggests they're not, rather than the other way around. Look for ways of involving myself or putting strategies in place to minimise risk of abuse of a person's rights, and always assisting the person to understand risk or partly understand risk. So in decision making, again, we're looking for ways of evolving yourself or strategies in place to minimise risk. Be aware of what rights are at stake. So understand, I'm actually breaching this person's freedom of movement, or I'm actually breaching this person's right to independence. And remember your obligation to uphold the full range of legal and human rights, recognising at times that if you are in an ethical dilemma or you are concerned about a duty of care breach, you probably are at least touching on breaching some of those rights. How to be a reasonably competent therapist or worker. The courts will apply the standard of care as being that of reasonably competent, skilled person. So when we talk about the term reasonable, the courts will look at, when they need to define what reasonable is, what would somebody with your skills, your experience do in the same situation? And when we're looking at common law, they will actually call witnesses up on the stand and say, in this situation, what would you have done? Another person, what would you have done? Another person, what would you have done? And what the majority say is usually what's considered reasonable. And they'll pull people up with the same skills, experience, and training as you. So if you're a new grad, you're expected to be competent in understanding your codes of conduct because you're taught that at university. But in the actual implementation of specific areas around that, you may not be as competent as someone who's been working in the field 20, 30 years or even 10 years. And they recognise that. But you also have a reasonable obligation as a qualified therapist, even as a new grad, to seek out that information, that support, and that training. So what you don't know, you don't know. So if you're not aware of certain issues because they haven't been raised through university, but once you come across, say, an ethical dilemma, as a qualified therapist, you are then obligated to work through that ethical dilemma, learn from it for next time. And the areas of learning are vast and wide. So we're looking at, of course, supervision. Supervision is so important in looking at ethical dilemmas, duty of care issues, those kinds of things. And we all have an obligation to seek out supervision. Peer support and review. As a multi-dis team, we have a very unique opportunity here to be able to confidentially, of course, look at situations and get a more broader perspective from other qualified therapists. Professional development is very, very important, keeping up to date with areas that are within your area of practice. Being a member of a professional association, they will often give you access to ethical dilemmas, codes of conduct, all kinds of information. They will have helplines that you can ring. Obviously, following current evidence-based literature, we're a science practitioner model, so we're looking at where is the evidence for this and looking at genuine research and studies that support certain practices that we may be using, and providing advice and services based on current evidence base. So obviously it goes without saying that we should always be operating within that area as a therapist. And that's the discussion on duty of care, finishing with a nice little picture of a bunny rabbit so that we end on a nice note. If you have any questions that have come out of this training, please jot them down, and please make sure that you raise them in your next supervision session or peer session to get those answers to those questions. Thank you.